Thanks for staying with us on Midday Kentucky. It is cold outside, which often means it's a little easier to get sick. And when children are not vaccinated, they're at an increased risk and can spread diseases to others in their classrooms and community. This does include infants who are too young to be fully vaccinated, and of course people with weakened immune systems due to cancer or other health conditions. Here to tell us more is Jill and Kim from the Lexington-Fayette County Health Department. Thank you both for being here. We appreciate it.
Thank you for having us.
Well, it's been a huge story in the news. A lot of schools have been closing their doors for days at a time because so many kids are sick in classes. What's going on there?
Typical winter. You know, this is the season that flu does increase, but then there's other viruses that are out there that can make kids sick as well.
Is there anything that can be done to prevent this from happening?
Getting your flu vaccine is really important with you know, a number of cases of flu, as well as making sure kids are up to date with their vaccination, so checking with their primary care doctors to make sure that they're up to date, as well as good hand washing. You know, making sure everyone's taking precautions and washing their hands and keeping surfaces clean, things like that.
Let's talk a little bit. I mean, I know a lot of people think we just go all in about the flu, but it really is a threat, so much that it's causing schools to shut down. That's huge. Has that been an increased problem this year so far?
So I don't know if it's been an increased problem this year more so than other years, but the schools do look at attendance and if there's specific symptoms or whatever that are consistent with a majority of the students that are going home ill, and then they make that decision based on that. But you know, as Kim said, you know, vaccinating and just taking care of yourself. You know, make sure you're eating healthy, drinking plenty of fluids, getting plenty of sleep. A lot of times, you know, kids are not getting as much sleep as they really need to.
Sure, all of that is very important in addition to those vaccinations. Now, I know throughout school-age students, there is a set schedule of what vaccinations they should be getting and at what time. How does that work?
So the CDC has a schedule that the physicians will follow based on the child's age, what vaccines they've previously had, and what vaccines they need. If your child is behind on vaccines, you know, don't worry. Talk to your physician, medical provider, and there is a catch-up schedule as well, so that the vaccines can be appropriately spaced so that your child gets some benefits from the vaccine.
So pretty much you keep saying talk to your physician, talk to your healthcare providers. This is a effort together to make sure everybody stays safe. When entering school, is it kindergarten? Is that when they immediately start that schedule, right before they enter school?
So we actually start the schedule at 2 months of age.
Oh,
typically.
wow. Okay, so young.
Yes, and daycare facilities and preschools are all required to, you know, maintain a child's vaccination records and make sure that kids are up to date.
Wow, and this goes all the way through college, right?
Yes. So the immunization requirements were updated this past year. And so in high school, there is an additional dose of meningitis vaccine that's due at age 16. And so that's the last time that in high school, but some of the colleges may require vaccines for specific programs or to live in the dorms.
Sure, and things are constantly changing, obviously. Can they come to the health department to get their vaccines?
Yeah, they can call the health department to see if they would qualify for the program that we provide for vaccinations. If they have a medical provider, a primary care physician, that's the best because they can go there, they can get their physical or their checkup, and get the vaccines.
If you could offer one tip to stay healthy this season, what would it be?
Drink plenty of water, get your good nutrition, wash your hands. Can't emphasize that enough.
And one thing that we say is, you know, if you are ill, stay home.
Good advice, and the schools are taking heed to that, so we should follow that as well. Thank you both so much for being here. If you're interested and want to find out if you qualify for help from the health department, there's their information right there. If not, visit your doctor. It is so important that we all work together to stay safe and stay healthy.